You're very welcome to Counterpoint. On this episode, we have a pretty dramatic presentation of a protected disclosure under the Protected Disclosure Amendment Act 2022 by a senior pharmacist in this country. And here to talk to me about it is Senior Counsel and Masters of International Relations, Una McGurk. Una, you're very welcome to Counterpoint.
Thank you very much, Eddie. It's a pleasure to be here. First
question I want to ask you, so people understand the kind of framework here. What is this Protected Disclosure Act that is being used by the pharmacist? And can you explain the difference between the Health Products Regulatory Authority, HPRA, and the Pharmaceutical Society of Ireland?
Indeed. Well, first of all, the Protected Disclosures Act is really known as the whistleblower's legislation.
Okay.
Because somebody who is a whistleblower will make what's known as a protected disclosure. And they can do that to any one of three bodies. They can do it to a minister, they can do it to the ombudsman for the protected disclosures, or they can do it to prescribed bodies under the Act. So in this particular case, this pharmacist that you have referred to has made a disclosure to the minister. In this case, it's the Minister for Health under Section 8 of the Act.
That's Jennifer Carroll McNeil currently.
Correct.
Yeah, okay.
But what this disclosure is, me being here today, is a disclosure under Section 10 of the Act, which is a disclosure other than one under 7 or 8, and it can be made in certain circumstances where, for example, the person who's making the protected disclosure, which is the pharmacist you've referred to, has previously made a disclosure of essentially the same material and nothing has happened. So in this particular case, the pharmacist in question has been making disclosures to two bodies in particular effectively over the last 4 years, and nothing has happened. And in addition to making the disclosures to these two bodies, on each occasion, he CC'd the Minister for Health, who was Stephen Donnelly. So the former Minister for Health and the Department of Health are very well aware of the disclosures that have already been made by this particular pharmacist. So he decided that he was going, at this stage, to make a formal, direct disclosure to the minister because he'd had enough. And that's what's happening. And so that's what he has done. And he has asked me if I would do this today. And I'm very honoured to be here to do this because, as you probably know, Eddie, anyone and everyone who makes a disclosure under the Protected Disclosures Act is entitled to their anonymity. So I can't take credit for anything that's contained herein. I've been given this information and I'm happy to bring it to your attention because the information contained in here is really quite shocking. It's a very profound document. This is a copy of the actual disclosure. It's 16 pages long. It consists of very technical medical information with links to various peer-reviewed independent studies from scientists and doctors, independent scientists and doctors at the highest level. And there's also a backup document, which is almost 100 pages, detailing the correspondence that this particular individual, that we call him the whistleblower, has had with various bodies, but in particular, the two that you've just mentioned, which are the PSI and the HPRA. Now, the PSI is...
That's the Pharmaceutical Society of Ireland.
Correct. Now, this is a statutory body. Both of them, by the way, are statutory bodies, which means they have obligations to the taxpayer. And the PSI is a statutory body whose role is the regulator responsible for pharmacists in order to protect the health, safety and well-being of patients. And this is very important and will become more crucial as we go into the information that's disclosed in the document. They have a statutory duty to recognise and respond to potential harms relevant to the protection of their patients. Now, that's a very significant statutory duty.
Now, in preparation for this discussion with you, somebody of your vast experience looking at a document as technical as this and so on, I went through it a couple of times just as a lay person, and it seems to me that, notwithstanding what you just said about the kind of non-response that this pharmacist has had over the last 4 years, and now using this nuclear option, really, I suppose, in one sense, of a protected disclosure, it seems to me that the allegations being made, backed by evidence, which we'll get into, seem to centre on suppressed evidence, cancer risk, fraud, ethical breaches, these are my notes, endangerment of life, financial corruption and regulatory collapse. So, I mean, that's what you mean by pretty serious allegations.
We're talking here about corruption at the highest levels within the state. So the information contained in this document is quite shocking, and I'll come into that in a moment, but I just want to tell you about the HPRA.
Go ahead.
Which is the Health Products Regulatory Authority. And their website, in describing their ethos, uses words like integrity, excellence, innovation, patient-focused in describing their values. For their mission, which is that of regulating medicines and products for the benefit of people and animals. And when we go through the evidence, the statutory functions of these two organisations will become very relevant, and it will become very apparent to the listeners and to the viewers that they are not carrying out their statutory functions, and that's just putting it mildly.
No, can I just pause you there? I just want to bring up something for viewers to see. It's diving straight into the middle, and we'll go back to the start.
That's fine.
Which is what happened at the start of COVID, which, as we recall, was Q1, Q2 2020, and then kind of repeated itself 12 months later. Can I just bring that up on screen next? I want to comment on this because it's in the protected disclosure.
If we start at the beginning, okay, first of all, and I think this is relevant because obviously this is a very technical document. I'm not going to read it out. That would be very boring for the viewer. So what I'm going to do is deal with it in a narrative form, in chronological order, going right back to the beginning. So we'll get to midazolam
when you're ready then, okay.
So I'm sorry.
No, that's
so
okay.
it will be very quick, I promise. I'm nearly there. So basically, in March 2020, as you know, we had the WHO declared the pandemic, right? Then we had the commencement of the lockdowns. That was basically at the end of March. I think it was the last weekend in March, okay? Now, it was very clear to everyone at that time that there were no deaths in the community, notwithstanding the disturbing images that we saw being beamed in from Wuhan and Italy and places like that.
Yeah, the propaganda,
so, exactly. And that's a story for another day. We could do another video on that. But this is what was happening. And yet everyone noticed that nobody was dying in the community. People were going about their daily jobs and nobody was keeling over on the street, thankfully, and thank God. So then in March, a very strange policy was introduced by the Department of Health, which was that they directed that patients, elderly patients who were in hospitals, would be taken out and put into nursing homes. Now, the person who was the Minister for Health at that time was none other than Simon Harris, our current Taoiseach. So this was a somewhat very unusual practice of taking these elderly patients out. As I understand it, the excuse used was that they needed the beds for this surge in cases that was going to materialise, that never materialised. And before I proceed further, I need to state it categorically because it is a fact. Hospitals were effectively empty in 2020. But then, of course, this left plenty of time for the certain doctors and nurses to practice their TikTok dances because they didn't have to look after these elderly people. They were sent into the nursing home. In the nursing home, there were no protocols for the care of these people. In the hospitals, they had been getting treatment, but when they arrived in the nursing homes, there was no protocol for treatment. And this is one of the things that you may recall Dr. Marcus de Bruin spoke about when you interviewed him recently. In fact, he was so incensed by this policy that he actually resigned from the Medical Council because he saw that there were no treatment protocols. And the only thing that they were given was end-of-life care, like do not resuscitate. And they were given drugs like midazolam. And I don't know if you know about midazolam, and I don't know if the viewers. It's an end-of-life drug. It speeds up your death. It causes kidney failure. It's a horrific drug. Not only that, but it is a respiratory suppressant. So why would anybody give midazolam to a patient that suppresses their respiratory system when we are supposed to be in the midst of a respiratory crisis like COVID? It simply doesn't make sense. So this was a very, very bizarre policy. Now, it's not clear who directed the protocols for the care or the end-of-life care. But what in effect happened was that in April of 2020, there was a spike in deaths in nursing homes in
Can
Ireland.
I bring up my slide now?
Yes, please. Yeah.
Okay, thanks.
Thank you. Thank you. Sorry.
I wanted to get to this slide as fast as possible.
Thank you very much.
Go ahead.
Yeah. And this is a slide, and by the way, this is a slide which is contained in this protected disclosures document, and that's why I'm using it. And so, for the viewer can see that the dark, thick lines represent the deaths that took place, and as you can see, you know, fourth in from the bottom, April 2020, there is obviously a very massive spike in deaths. I mean, it's very, very clear. And then coincidentally, the thinner line, which in reality follows it, it's red in reality, you can see it exactly. There's a huge spike then of that thinner line. That thinner line represents the administration of midazolam. So here we have a correlation, an exact correlation between the administration of midazolam and deaths. And we know from research that's been done that those deaths effectively occurred in nursing homes.
Yeah, I got a phone call actually from an insider in the industry around that time, saying you need to go and look at the sudden increase in midazolam being supplied to nursing homes. And I was so busy doing other stuff, I didn't have the bandwidth to follow it anyway at that stage.
Of course, and you're so busy. But thanks to this whistleblower, this is one of the many graphs that are included in this document, which is extremely important.
Now, can I just go back to that slide again, because it spiked again, it seems, 12 months later.
You can see the next spike is a spike in January of 2021, which of course coincides with the rollout of the vaccine, and we'll come to that because that forms a very, very important part of this document. Can I just stop you there? Yeah, exactly. But just on that, because I've covered it before, I just want to jump to it because I think it's relevant. So there was a big study done by Rancourt and Company et al. In Canada. They looked at about a quarter of the world population that had been injected. So that's very, very many countries. And they came to the conclusion that there's no data surge supporting excess deaths from any pathogen, but there's very strong evidence to show that there was excess deaths from the response to the so-called pandemic, and of course the rollout of mRNA vaccines, and particularly that study showed in many places a surge in the deaths in nursing homes, coincidental with the start of it. So there was three areas of causation of that. So there was the suppression at the start of the nursing home deaths spike, which we can see there in the Irish data. They put the total amount of excess deaths globally at 33 million, of which 17 million were temporarily in time correlated to the rollout of mRNA vaccines. Yes, and before that, they also did a study with regard to the spike in alleged COVID deaths, and the first spike that Rancourt identified and his team identified was, guess what? A spike which occurred between March and May of 2020. So that coincides perfectly with what happened here in Ireland. And what he discovered.
So what you're saying here, so what you're saying here is that the protected disclosure by the senior pharmacist in Ireland to the authorities in Ireland who've ignored his disclosure so far is actually directly corresponds to the results of the Rancourt study.
Exactly.
Okay.
Yes. And in that, the Rancourt study, what they discovered was that this virus wasn't, adopting a normal path. It was extraordinarily discriminatory, and in its path, because it was very prevalent in some areas, and then it wasn't prevalent in other areas. And they said this isn't the path that a normal pathogen would take. So when they carried out the studies, they discovered that in fact the spike in deaths that occurred, including the spike in this particular time period that's relevant to Ireland, occurred only when the aggressive medical interventions were undertaken, such as the ventilators, which we now know killed at least 90% of those who were on them, and guess what? The use of midazolam. So it's in the Rancourt report. So the Rancourt report actually supports what's contained in that
Okay, so
diagram.
Let's just walk me through the evidence, the other evidence, because there's quite a lot in it.
There is a lot, yeah. So, as I said, it was very bizarre that these people were being given a respiratory suppressant. So we've dealt with all of that. Now, in one, and I just want to mention this because it's particularly damning, in one case there were 8 people, 8 elderly people died in one hospital care home in the Midlands in one weekend during that time. It was during Easter. So what we have now is they have the deaths. The deaths, you see, were not occurring naturally in the environment or in the community. But now they have their surge in deaths. So this, of course, was fed into the mainstream media, fomenting the fear for the people. Enter stage left the PCR test. Now, it had already been in use, but now it really was being ramped up, this PCR test. So
what we're saying, what you're saying so far is that the initial surge in deaths, which was used to scare the population, was actually caused not by, well, apparently not by the pathogen, but actually by the treatment or response to the elderly people being taken out of hospitals and put into nursing homes.
That's right. Okay. Or so it would seem. I mean, these correlations are alarming. Obviously, I can't call it definitively. That would be inappropriate. But what I'm saying is these correlations are very serious, very alarming. And in themselves, this incident alone, it warrants a very, very serious criminal investigation. And really the families of these people should be, these deceased people should be asking what medicines were given to their elderly relatives, you know, before they passed. Was it midazolam? Was it morphine? Why were they being given end-of-care treatment? I mean, this is very disturbing.
And where did the instructions come from?
And where exactly did the instructions come from? Okay. So this is very serious. So you can see why Dr. Marcus de Bruin took the action he did.
Yeah, absolutely.
And also this information ties in with the information he gave you in the interview.
Well, I'm not asking you to comment on this, but what I find stunning is the silence from all the doctors who didn't stand up, given what's in this protected disclosure. But let's get on with it.
Exactly, and we'll get on to them. Yeah. So anyway, as I said, enter stage left, the flawed, fraudulent PCR test. So they needed...
No, that's in the disclosure as well.
Yes, it absolutely is. They needed something to justify lockdown. So this was the next phase in the plan. Now, I just want to digress for a moment, if I may, because this is relevant to me. I was the first person to call out the PCR test 5 years ago when I attended a protest rally in August of 2020 with, coincidentally, Dr. Marcus de Bruin, because I had studied this, because I knew Carrie Mullis, the man who had invented the PCR test, had said it should never be used to test for an infection. And I saw the video where he made that claim. Now, very sadly, but very mysteriously, he died in the autumn of 2019. So when they rolled out this PCR test, he was not there to say, I'm sorry, guys, you can't do this. So anyway...
as I understand it, Una, and just to give you a chance to catch your breath.
Thank you.
The PCR was set at 45 cycles, and of course it's on like a Richter scale, right?
Yeah.
And I've described it as well. If you set it out to look for evidence of the Black Death, you would find it at that level of magnification.
You're absolutely right, and you've got it in one. And even if one were to use it, if you were, it's done in cycle thresholds. If you did it at a cycle threshold of 25, that wouldn't be so bad. But because they did it at 45, it literally meant that if you had a flu 5 years ago, it would pick up some debris or protein and it would show up in the test. But the test would be recorded as a positive test. So the entire country was locked down based on false positives. And I just want to tell you what the pharmacist who prepared this disclosure said about it, because it is important. And I will quote from the document at relevant times. He described it as being run at a cycle threshold of 45 as being totally ludicrous and indefensible. Absolute junk science. A cycle threshold doubles the DNA on each cycle. 35 cycle threshold would be considered a very high cycle threshold to determine the presence of the target RNA sequence. And he said there's a 1,024-fold difference at 45 cycle threshold. At these detection thresholds with ultra-high PCR amplification cycles, the testing is so unreliable that it is totally meaningless, except for the fortunes that were made of the back of it. And he makes a reference, I believe, that there are some high-profile people involved in various committees that were telling the country what to do, who had financial interests in the laboratories that were conducting these tests. So it's very likely that there were serious conflicts of interest involved in dealing with this. I think you might need to get Nick Delahanty on board for some of this, Eddie. But he also goes on to say, and this is very important, billions of euro of Irish taxpayers' money was squandered on a totally unreliable and scientifically flawed diagnostic test. Death counts were inflated by redefining any death with a positive test in the preceding 28 days as a COVID death. Thus, vaccine lives saved and COVID death figures are rooted in fraudulent diagnostics.
Now, can I just stop you there, right?
Yes.
So I just took a note just as you were saying that. Yep. Therefore, one of the, this is going into a commissioner, right? This disclosure document. It's up to the commissioner to decide who he's going to send it to.
Exactly.
But if the commissioner's listening to this, then this part of it must go to the comptroller and auditor general.
Exactly.
Because this is a fraudulent use of public funds.
You're absolutely right. You're correct. And what's very interesting about this particular disclosure, and it shows you the expertise of the person who made the disclosure, that to make the job of the ombudsman, the protected disclosure ombudsman, easier, he has actually set out a list of potential prescribed bodies under the Act that this could be sent to for further investigation. And one of them is the Controller and Auditor General. And on the basis that there was gross mismanagement and fraudulent use of public funds with regard to vaccines, the advertising of same, PCR testing, etc.
Okay. Oh.
Yeah. So this is just one of the many important things that were dealt with.
No, he's making a big deal as well. Sorry, Una, just about the fact that things weren't tested properly, like for example, cancer causing impacts of this mRNA vaccine, the impact on the DNA, the chromosomes, and of course the damage caused by it.
Yes.
And what particular points is he making there on that? I mean, is he talking? Is this aimed at the non-response from the Irish agencies, which we've talked about, HPRA and the Pharmaceutical Society of Ireland, or is he aiming that at the pharmaceutical industry?
Well, essentially, that would be aimed at the Health Products Regulatory Authority.
Okay, because they're the gatekeeper. That's the point of his making it.
Okay. For the products.
Okay.
And basically, he said there was no carcinogenicity or genotoxicity or integration studies performed. The HPRA, when he contacted them, and I have seen the correspondence between him and the HPRA, they constantly defer to the EMA, which is the European Medicines Agency, on these matters, thus abrogating their responsibility and their statutory obligations to the people. It's quite shocking.
The European Medicines Agency is just the overarching agency in Europe.
Yes.
But what you're saying is that doesn't absolve them of their legal responsibility as regulators in Ireland.
Correct. But
so it's a PR device, basically.
It is, but the situation is a little bit tricky because under the Lisbon Treaty, the Treaty for the Functioning of the European Union, under Article 168, there's a shared competence in relation to public health between the nation state and the EU. So it's a shared competence. So that does give the EU certain jurisdiction with regard to these matters. But what is happening now is that the Irish regulators are just sitting back saying, oh, it's nothing to do with us. We let our counterpart, our European masters tell us what to do.
Yeah, we were just following orders. That's the Nuremberg defence. Yeah.
I mean, if that's the case, they shouldn't be in those positions. I mean, these people are earning a lot of money at the taxpayers' expense. It's their job to act as gatekeepers and protect the Irish people, especially with regard to the products. But they're not doing it. And I've seen it. I mean, this person has been amazing for the patience that they've had in writing to these people, constantly getting fobbed off. So they know perfectly well what's going on. They've been told countless times by this individual. They have been sent the independent peer-reviewed papers. It's not just the opinion of this pharmacist. We're not talking just about the opinion of one man. This is all independent scientific evidence that's being presented to these people and they're not listening.
There's so many studies. I mean, it just strikes me there that the cancer-creating impact of the mRNA vaccine
Yeah.
has been outlined to me by way of interview with Professor Dalgleish, right, who is a leading
expert.
He's a leading expert.
Oncologist,
He's an oncologist. He's a virologist. He's 7 years on the board of an mRNA company, so he knows what he's talking about. And he's saying we have to stop sending out these mRNA vaccines because they're creating cancer, because they're suppressing the cancer. They're beginning to destroy the human capacity to suppress the cancer inside.
Yeah.
And that seems to be very consistent because based on the data that has been, I know I'm diverging here now slightly, but based on the data that has been looked at globally, if you look at the work of Edward Dowd and his team in Hawaii, he is saying that for every one excess death, that his studies have also shown up, that there are 4 disabilities created by the vaccines. And that's very serious. And that 4-to-1 ratio seems to be consistent. So if there's 33 million excess deaths created, then the amount of disability is 4 times that. And then his estimate is that about 18% of the people that took these vaccines have been harmed in some way, not disabled, but harmed in some way. So these are numbers, just so people watching this, these are numbers that are vastly in excess of the acceptable threshold to allow vaccines to remain on the market until now.
Absolutely.
And yet we're continuing to inject people.
And continuing to roll them out. And people like Professor Dalgleish and, Dr. Peter McCullough, who was one of the most eminent cardiologists in the United States. He was the most peer-reviewed cardiologist of his day, have literally been shouting from the rooftops, please stop this rollout. And they're being ignored by mainstream media, who are complicit in all of this because the mainstream media are protecting the government and they are protecting the health officials and by implication these regulators as well.
Well, Dr. De Bruin, who sat there in that chair, told me that a large proportion, like 90% of the of our health force are not taking these vaccines anymore. They were not taking, but we're continuing to inject people, and that's because people are being paid to inject. So there's money involved.
It's shocking, it's reprehensible, it's unacceptable that this vaccine is still on the market and it's still being rolled out for adults and children. Children who are never at risk from COVID at all. It's outrageous. But the other very interesting thing about, of course, the whole COVID vaccine scenario is that these are not vaccines in the traditional sense, as you know. This is a new...
So you just changed the definition of vaccine to allow it to happen, yeah?
Correct. I mean, the traditional vaccines, and I think I'll just explain this maybe for the benefit of some viewers, because I think this is how a lot of people were conned into taking this, because they assumed, understandably, that what they were getting was maybe a more sophisticated version of their flu vaccine, which was going to deal with this deadly virus and allow them to get back to normal. And of course, they were under enormous pressure and coercion from the state and from the government and the media to take these vaccines. But in fact, these are not vaccines at all. A traditional vaccine works by introducing an antigen or a piece of attenuated virus into the system, which stimulates the immune system to produce antibodies, so that if you encounter that infection or pathogen in life, that your system will remember and continue to produce the antibodies. In this case, it's not. It was an untested, experimental messenger RNA gene therapy. And what they did was they took a spike protein, which is known to be very, very dangerous and carcinogenic, and they wrapped it in a nanoparticle and they injected that into people's arms, essentially. And this
and they told us it wouldn't go beyond the injection site.
Correct. But this spike protein has an instruction. Once it gets into the cell, it instructs the cell to create more spike proteins. So it's already a very dangerous pathogen. It's being introduced to your cell, and absolutely the regulators, and it's stated in this document, the regulators lied when they said it was safe and effective. The regulators also lied when they said that the injection, the contents of the injection would stay near the injection site. We know for a fact, and there is the Yale study, which proves that the spike proteins were found in lymphocytes some 700 days after the injection. They have also discovered spike proteins in the tumours of people in autopsies. So the spike protein is going all over the body. But what's really dangerous about the spike protein is that there is no off button. No off button.
And just to move on to another point which has come up as well, because it's jumping out in this as well, is that that there's been studies done by quite a lot of scientists now throughout the world, led, it could be said, by McGurk in America, which seems to indicate, and duplicated in many other, duplicated independently, which is the acid test of an observation in science, that it's observed independently elsewhere, is that that many of these vials contain contaminants, including SV40, which is a proven cancer-creating agent.
Absolutely, absolutely. Especially, they've discovered this in the Pfizer vials. And also what they've discovered in many of these vials is, well, it's actually that there are contaminants in it which disrupt tumour prevention pathways, which is really important. So normal pathways that your body would have to prevent the development of tumours have now been disrupted to the extent that there is now no protection to the development of tumours, which is why you have a surge of aggressive cancers post-rollout, particularly in the younger demographics. Commonly
called turbo cancers.
Yes.
So people are turning up with stage 4 cancer.
Correct.
Yeah. Not like stage 1 or stage 2, stage 4.
Within weeks. And this is a fact and it's a phenomenon and we all know about it. It's happening within the community. So just because mainstream media are not talking about it, just because government ministers are not talking about it, just because it's not an RTE, doesn't mean that it's not happening. It is happening.
Now, when he's made an observation as well, I noticed, about the extraordinary amount of coincidental slogans appearing during this period worldwide, like follow the science was one major one. We all remember that. Safe and effective, you've mentioned that.
Yeah.
The pandemic of the unvaccinated. Can I just stop at that one?
Yeah.
The pandemic of the unvaccinated.
Yeah.
Because we had a situation here where people who were on the organ transplant list in Beaumont Hospital were being kicked off it because they were unvaccinated.
Outrageous.
We were demonising people that weren't vaccinated, and we now found that the actual the level of harm and excess deaths and all the rest of it seems to follow the vaccinated population around far more than the unvaccinated.
Yep, absolutely. And again, that was another lie that was perpetrated by the media, by the government. And there's another interesting graph in this document, actually, which shows an excerpt from, residencies in a particular hospital, which is the regional hospital in County Waterford. And as you know, County Waterford is the county which has the highest rate of vaccination. And what it shows clearly is, and I have it here in front of me, may be able to put it up as another graph on the screen, of the 20 admissions in the hospital, only five of them were not vaccinated. 15 of them were. So in fact, the opposite is true. The evidence would indicate that in fact the people who were in the hospital were vaccinated, not unvaccinated. But as you know, of course, we were told the opposite. But, that's all part of the gaslighting of the public, which has gone on now for quite a while.
Yeah, well, one of the things that is apparent, just in common observation, everybody talks about it, just not talking about it in mainstream media, is the amount of people we all know. And I'm not just speaking for myself, I've spoken to many people, we all know people whose health has never recovered since and I'm not talking about elderly people, just hasn't recovered.
Yeah. And
this is consistent with the data findings of Rancor and especially of Edward Dowd and many others. So it's quite extraordinary that as recently as last week we had the Taoiseach Micheál Martin at a conference in Europe announcing his unbridled support for one of Bill Gates's organisations, Gavi, which is a vaccine vaccine innovation organisation, and sitting in the audience was Ursula von der Leyen, former trustee of the World World Economic Forum. Basically saying, we just love vaccines and we've just written a cheque for 22 million for more vaccines.
Yes, it reminds me of the time, I'll never forget it, one of the few times that I did watch TV during the pandemic era, when Leo Varadkar as Taoiseach came on and sat on his throne, attempting to look very dignified before the Irish people, where he made this very profound announcement that he was giving 25 million of Irish taxpayers' money to Gavi and to the WHO. Well, we know that Gates effectively controls the WHO anyway. And all he was doing was giving money to Bill Gates so that he now, instead of being a multi-billionaire, he could become a multi-trillionaire. And I just wondered, why was nobody objecting to this? It was extraordinary. But he made the pronouncement and the statement as if somehow it was something very important that he was doing on behalf of the Irish people. And so this is what we get, you know. Basically, what the Irish people got was an involvement in a dangerous experiment. Really, that's what can be said.
Well, my own view is that I put that at the mildest level. Yeah. I mean, if you go back to, if you just join the dots outside of Ireland for a second, if you go back to September 2019, that was the first time that there was, you know, according to the study done by the Joint Committee of the US Congress, that was the first evidence of something unusual happening in Wuhan. And that was the same month that Gates Foundation put over $50 million into BioNTech, which became the partner to Pfizer. Yeah. And then spent the next 2 years going around the world telling everybody, get the vaccine and you won't get COVID. By the way, that was repeated in Ireland. It was repeated by President Biden. It was kept being repeated, and including by Gates. And then 2 years later, when they sold their shares in BioNTech for 1.3 billion, the same month he says, oh, by the way, this stuff doesn't stop the transmission of the virus. Sorry about that. And the same source is the source of most of the funding going into the World Health Organization. The United States is leaving the World Health Organization. They're leaving Gavi. And here we are.
They're still supporting them.
Still supporting it. And quite happy to sign, if it came along, a treaty which would bind Ireland into another one of these, we have to do this because we've signed an agreement internationally type of an arrangement. It's quite extraordinary. Quite extraordinary.
A lot of secrecy involved.
So where does this go from here?
One thing I just need to say, because I think it's important for your viewers, because I do know there are people out there who have had the vaccine and haven't had any, thankfully, haven't had any ill effects or haven't had any symptoms. What we do know, and it's again referenced in this report, is that there were, you know, the batches varied. There was a differential in the batches. And, you know, which again, is
That's extraordinary, yeah.
Because standardisation is really, really important. And this is something that the HPRA in particular should be watching out for. I mean, it's outrageous that they should be informed that there is evidence that you've different batches containing different products. So it may be that some people, and hopefully most people, didn't get anything that was maybe potentially very dangerous. But the reality of it is many people did. And we both know many people who are not well and have not been well since the vaccine. And I find it extraordinary that they are, you know, they're being gaslit by their doctors. And in one case, I heard of somebody who was complaining of being unwell. She goes to her doctor and the doctor tells her that she needs to go on antidepressants, that it's all in her mind. Someone else I know has been told that they have long COVID. There's no such thing as long COVID. COVID, such as it was, came and went. There's no such thing as long COVID. These people are very likely to be vaccine injured, but because there is such denial within the industry, they're not being properly looked after or properly treated. One of the things that I've said, and indeed you may have very well coined the phrase, and I think it's important to say it in the context of what we're talking about today. When COVID came in the door, common sense, critical thinking and the precautionary principle joined hands and jumped out the window. And that's really what we've been dealing with for the last 4 years. It's really quite extraordinary, but that is the situation. So just want to see, is there anything else at this? That I had written down.
Well, can I help you, right?
Of course, protein. Are we finished with that?
Yeah, just again to give a little bit of context.
Yeah.
So there was an administrator of the MRA rollout in New Zealand. Acted as a whistleblower and came forward and released information to the public. And of course, straight away was raided and cautioned. And I don't know where that's going. But it's a legal process.
I think he was imprisoned, actually.
Yeah. Or did he go to prison? Yeah.
I think so.
Extraordinary. So what can we say to those in Ireland that are in the pharmaceutical industry? They know what's going on. They're keeping their heads down. There are doctors out in the general medical area. They know bloody well what's going on, and they're keeping their heads down. There's hospital consultants left, right, and centre in Ireland. There's over 20,000 doctors regulated by the Irish Medical Council. Most of them know what's going on. All of the data is out there. All of the studies are coming in from all over the world. The very fact that the Irish mainstream media are not reporting on that doesn't mean it's not actually after happening. And this thing is going to come at us like a train. So for me, it's a question of, if you're out there and you're keeping your head down, well then silence is collusion, in my opinion anyway, in my book. Come forward with the information, follow this pharmacist with your protected disclosure, and let's nail this thing shut. Because if we don't, if we don't, the next time around, we're going to be in a worse position. Most of the damage was done, as we can see, in my opinion anyway, by the MNRA rollout, but also by the medical impact of lockdown. And when you look at lockdown, there is no minutes of any meeting at the WHO, and there's no minutes of any meeting in Ireland where a decision was made to lock down the Irish public, as opposed to the known science of letting the respiratory virus run through the population.
Exactly. And never before in the history of the world as we know it would you ever consider quarantining healthy people. You only ever quarantined sick people. That makes sense. You quarantine the sick, but you do not quarantine the healthy. It was an outrageous abuse of what was by then established science. So they were literally making it up as they went along. There was obviously a script. They were all reading from the same script, because this was a lockdown process that happened all over the world. They all used the same phrases. We had this mysterious spike in deaths between, in the month of April in various strategic locations all over the world, which paved the way for the use of the PCR test, which came in, which justified the lockdowns. We know that the PCR test was a useless piece of junk. I mean, how many people spent weeks in their bedrooms not connecting with their family, thinking they had COVID, when in fact they didn't have COVID? How many people died who were where it says on the death certificate that they had COVID, died from or with COVID because they'd had a fake fraudulent test 28 days earlier, when they didn't die from that at all. I mean, it's outrageous what's happened. I mean, it's really shocking.
Well, the scale of it is probably part of the problem, that people are finding it hard to psychologically accept it. Yeah, exactly.
That it's so vast that they can't comprehend.
But the reason for that,
the government would do it.
The reason why, yes, that's the point. The reason why people finding it hard to comprehend is that it's a global scale. So the next question you begin to ask yourself, well, who's behind all this and what's their objective? And we won't get into that, right? But I mean, that's the point. I mean, here you have an extraordinary document by a very courageous pharmacist stepping forward, putting it up to them, and this person needs to have a lot more Irish people out there in medical land join him.
He does, yeah. He absolutely does deserve that. I mean, there's years of work have gone into this document. I mean, he is to be commended, this individual, for what he's doing. But the question then arises is, what's going to happen to this protected disclosure?
Well, I mean, look. At the moment, the establishment, the medical establishment, the permanent government, most of the political establishment, and especially the mainstream media, because they were on the wrong side of all of this by active decision. They're all an operation cover-up. I mean, that's what I describe it as, operation cover-up. Yes. They're going to try and deny this and denigrate those that bring it forward for as long as they possibly can get away with it. But my point is that it's too late. This is coming at you like a train. And it's either going to break through from the outside or it's going to break through from the inside. It'll probably be both over the next while, as the data and the science and the pressure builds. Yeah. And you can see that happening with the progress being made by Robert F. Kennedy Jr.
That's right.
In the Trump administration.
And also it's very interesting that Robert Malone, who was very much involved in creating the technology for this mRNA injection, himself has been screaming from the rooftops that it should not have been used for any COVID-19 response. And he is the man who actually invented the technology, and he is now on an advisory committee with the Secretary of Health of the US administration, Robert F. Kennedy Jr. So this is so interesting. So we are very much behind the scenes in Ireland with what's going on. But I mean, there's going to be, I mean, I can see legal actions taking place because one of the significant features of the vaccine was that there was no informed consent. No informed consent. I mean, everybody who administered this vaccine, and it doesn't matter if they got someone to sign a consent form, you know, it was signed under false pretenses because nobody, and I mean nobody, who got this vaccine was informed, this injection, because it's really not a vaccine, this experimental technology was informed of the dangers. This is very serious, very significant. It is professional malpractice for any pharmacist or any doctor who has administered this vaccine without informed consent, without giving informed consent to the person who received it. So what we're going to see is a slew of legal cases in the future, and this is very serious, and it's going to be very serious, not just for the people involved, but also for the indemnifiers, who have also been warned.
Can I ask you about that particular matter? Because there was a case there I took some interest in at the start of the year at the ECJ, European Court of Justice,
yes,
from Dr. Frigesi in Italy.
Yes, I'm familiar with that. Yes.
Yeah, and the ruling there, from my layman's reading of it, was that you've no standing in the court because you actually had discretion as to whether or not to give this compound out. And by the way, you need to have a prescription per product.
That's right.
And where's your prescription was the question that was coming into my head. And in other words, that GPs can't rely on the Nuremberg defence. We were following orders. Because it's already clear for me anyway in that ECJ ruling that it's not that easy. You just can't get out like that, you know.
Yeah, but in the Frigesi ruling, they ruled on other matters. That was really like
it was a sideline.
It was a sideline. They didn't actually give a ruling on that, but it was very interesting how they referenced it, and they said really it's up to each member state and what the law is in each member state. But look, there's a lot of this is a very, very serious situation for everybody involved, which may explain why there is such a deadly silence about this, because people are afraid to break ranks because of the potential fallout. But the bottom line is a lot of people have been very seriously injured. And then we have this shocking scenario where we now have almost 23,000 excess deaths in Ireland, which cannot be accounted for by anything really other than the rollout of this technology. I mean, it's clear that there was some event, some significant event, which has occurred in Ireland, which has now caused 23,000 excess deaths. It wasn't from COVID, because there were no excess deaths in the so-called pandemic year of 2020. The excess deaths, apart from the spike in April, began in January of 2021. So the excess death can only be correlated with the rollout of the vaccine.
Well, can I ask you just one last question, if I may, Una? When you stand back from all of this for a second, and you look at the amount, like we have to rely on the medical sector in Ireland. We have to rely on our doctors, our hospital consultants, our nurses, the infrastructure, the regulators. We have to be able to rely on these people. So if a huge number of them, and I'm talking about in leadership positions, completely failed in their duty of care to the Irish people as a consequence of all of this, then isn't the way forward to have some kind of truth and reconciliation commission where people can come forward, know that and basically get it off their chest and move on? Because I mean, this will not be solved, in my opinion, by a kind of a confrontational outcome. I think that's going to happen maybe at the people at the very, very top. But everybody else, it's like any of these. It's like being in a war zone and discovering that there's all sorts of blue fire. You know, blue on blue, and just come forward and just get it done. And I think that's what needs to happen, because we can't otherwise we can't go forward. I mean, no nation can go forward where there's a massive amount of distrust building up between the people and the people who are looking after their health.
That's correct. And I think you've made a very good point, and I'm sure there's a lot of fear within a lot of the professions about what's happened and what's going to happen. And of course, there's different levels of culpability. There's maybe moral cowardice or moral culpability. There's, ethical culpability. There's non-feasance, misfeasance, malfeasance. right up to negligence, gross negligence, you know, and it varies. And trying to determine that when there are so many people involved would just be an almost impossible task. So I think that's a very good suggestion that you've made, that there should be a Truth and Reconciliation Commission, because at the end of the day, most, if not all, doctors care about their patients.
Absolutely. Yeah.
They may have made mistakes. They followed orders. They assumed that what they were told by the HPRA and the pharmacist from the PSI, that what they were administering was okay and wouldn't harm their patients.
But they were also being handsomely paid, Una.
Yes, they were being handsomely paid, but they were also misled. So, you know, it's a complicated mess, really, on so many levels, and it's very easy to see that. So something has to be done, but something has to give, because it's like there's a dam there and, you know, it's ready to burst, and it has to burst, because until it does, and until we clear the air with regard to this shocking incident involving our people, which has caused such horrendous damage and death. There are 23,000 people likely dead who should still be alive.
But we don't.
Today.
Yeah, but the problem is that we don't have the data on the disabilities that have been caused in cancer, in autoimmune disease, and in what else? Oh, sorry, and in cardiac problems.
Exactly.
I mean, we don't have that data. It's not been collated.
And just on that issue, if I don't know if we've time, but it's one of the points that was raised by the whistleblower to the HPRA, because, as you know, there have been an awful lot of sudden deaths, especially of young people, athletes on GAA pitches, young girls, marathon runners, young people in the prime of their life.
All coincidental, no?
Oh, yeah, just mysteriously dying. Okay, there is a very easy way to determine whether or not that death was caused by a vaccine. It's known as the Arne-Burkhardt test.
This is a tested autopsy.
Yes, absolutely. So this test could be done, but very mysteriously, pathologists are not doing this test on anybody that dies suddenly. And I would have thought that anybody who dies suddenly should have had this test done. But also the coroners in the inquests are not making this as one of their recommendations, because it's like they should know about it. I believe they do know about it. So they don't want to know what's causing the death. But for the families out there who have suffered the loss of a family member in a sudden way, they should really demand that this test be done, so then that they can know definitively whether or not the death was caused by the vaccine. One
last question, then we'll wrap. We've covered an awful lot of ground.
Yep.
Are the pathologists and coroners under instruction from an overall regulatory authority? I think presumably the pathologist is leaning into the Irish Medical Council, but the coroners, are they independent of the state, or are they state funded?
I don't know. I think they're state funded.
I always follow the money.
Yeah, they're state funded. Of course they are.
Follow the money.
Of course they're state funded. They're appointed, as far as I know, by the Minister for Justice.
Okay, well, listen, Una, that's been fascinating. I wish the pharmacist, all the best of luck with this, because he's going to need it.
Yes.
I think that we need to get behind him. It's time we started to talk very openly about this.
Yes.
I would say to the editors of Irish newspapers and RT and so on, you're way offside on this. This is coming at you like a train. Now is the time to jump ranks and to start dealing with this using top journalistic quality to go after it. I don't think you will, by the way, but I'm just saying and putting it on the record, I think that's what you'd be doing, and you'll be certainly hearing an awful lot more about it from Counterpoint. Thank you very much. Thank you very much, Una.
You're welcome, Eddie.